Hey guys, well, welcome. The 31 days of mental health have started. This is Mental Health Awareness Month, and I hope you guys have enjoyed the series so far. And I just, hope to actually help someone that may not know. So, for today, we're going to be chatting about actually what is mental health. So, mental health is defined as a state of well being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Now, there are six known types of mental illnesses. Number one, anxiety disorders. Number two, depression. Number three, eating disorders. Number four, personality disorders. Number five, post traumatic stress disorder, which we know as PSTD. And number six, psychotic disorders, which includes schizophrenia. So that is just the basic of what mental health is and the types of illnesses that they identify by. I'll break down later on in the series exactly what these illnesses are, when they start, and what to look for, how to cope with it, different little nuggets that we all need to know about these illnesses that are severe in our community and all communities, but more so in ours because we're uneducated about it and we don't know a thing about our mental health. No, we don't know a thing about our mental health. So yeah, what better month to explain mental health than Mental Health Awareness Month? Woo! So yeah, I'm just going to start off with why does mental health matter? Mental health matters because it includes our emotional, our psychological, and our social well being. It affects how we think, it affects how we feel, and it affects how we act. It also determines how we handle stress, relate to others, and make choices. Mental health is important in every aspect of life, from your childhood to your early adolescence, all the way up until your adulthood. It's going to follow you forever for the rest of your life. So start taking care of it now if you haven't taken care of it. And if you take care of it but you don't take it serious, now is the time to take it serious. There are 5 reasons that you should never, ever neglect your mental health. And I'm going to go through those 5 reasons. But never neglect your mental health. I don't care what is going on. Always put your mental health first because you are stronger than what you're going through. I don't know who that is for, but you are always stronger than what you're going through. I promise you, you are. So for those 5 reasons you should never, ever neglect your mental health, go as follows. Number 1, your mental illness is more common than you think. There's a whole world full of people out here with the same issues that you're going through. I guarantee you, you are not alone. You are not alone. Although disorders range in severity, around 1 in 6 Americans suffer from some type of mental health condition in any given year. Unfortunately, too many don't seek help, which is true. Nobody likes to get help. It's pretty obvious. It could be embarrassing, whatever the issue may be, but get help. It's people trained professionally to help you that don't mind helping you. They know what's going on. They don't care. They just want to get you back right. That's all they want to do. So get the help. Better now than never. Number 2, mental illness affects your physical health. Mental health is not separate from physical health, but your brain is a part of your body. So what you think is going to make your body react. So when you think bad, your body reacts bad. Think good, your body reacts good. Hand in hand, good. Mental illness is the root cause of many physical symptoms, i.e., insomnia, heart palpitations, fatigue, no appetite, like everything you experience when you're experiencing a traumatic situation. It affects your health, your body. Your physical ability to do anything is affected when your mental health is not aligned, in order, or disturbed. Depression is one of the main mental illnesses linked to acute coronary. I don't really know how to pronounce it. I think it's the heart disease syndrome. Yes, that one. Acute coronary syndrome. There we go. Coronary. Coronary. Acute coronary syndrome. I don't know, but that's the word. Depression is linked to it. And it's linked to a whole lot more physical symptoms. Number 3, diseases or injuries can increase your risk. Diseases such as cancer, multiple sclerosis, diabetes, strokes, Parkinson's, epilepsy, like all of those increase your risk of having. So yeah, all those diseases increase your risk of having a meltdown or, just losing your mind, because those are some pretty serious diseases, and when they play a part and our life depends on it, we think the worst of everything. But when you think the worst of everything, you're affecting your mental health. So now you turn around and trickle into affecting your actual health. Because when you think bad, again, your body reacts bad. When you think good, your body reacts good. So it's good to know to take care of your mental health through whatever you're going through, whether it's something dealing with your health, whether it's something dealing with your spouse, your finances, whatever it is. Don't neglect your mental health. Please do not neglect your mental health. Number 4, early detection makes a difference. Early diagnosis leads to better outcomes. Most of us don't go around asking our family history, which we should start back doing, because it's a lot of our health issues tied to our family history just because it's generational. But getting help soon can prevent the symptoms of mental illness from getting worse. Not saying that you can stop it, but you can slow it down or you can prevent certain things. Treatment can help you avoid the negative effects those symptoms have on your life. So it's highly encouraged to get treatment, because the outcome of whatever issue you're experiencing could be a whole lot worse if you don't. So number 5 of the reasons why you shouldn't neglect your mental health is because it runs in the family. Like, your family health history helps predict your risk of mental illnesses, because mental illness can run in families for generations and generations and generations and generations that were probably here way before you. And it's pretty important to know the type of issues that your aunts, great aunts, granddaddy, grandma, granddaddy, all those people went through or, suffered from. So you can get tested for those beforehand, especially when it comes to your mental health, because mental health is a silent killer, and it's only because that's one thing that we don't think about to go get checked. Why do we neglect our mental health? So yeah, it's definitely a generational thing. But when you do go, be sure that you include the information about heart disease, cancer, and other conditions, but especially your mental health. You want to dig through your family history of what this person suffered from, how this person managed this, how this person did that, because that's going to determine, for one, if you're going to be at risk. And if you are at risk, then you can prepare in advance for how to go ahead and combat the situations beforehand. So I just want to leave you guys with a simple quote for Mental Health Awareness Month. And it says, just because no one else can heal or do your inner work for you doesn't mean you should or need to do it alone. By Lisa Oliveira from Mental Health Match. And I'm going to read it again. It says, just because no one else can heal or do your inner work for you doesn't mean you can, should, or need to do it alone. There is a whole world out here willing to help you if you make the first step and just go get the help that you need. And so in closing, I want to leave you guys with a prayer for good mental health. It's called the Good Mental Health Prayer. So it says, God, my deliverer, please rescue me from dysfunctional thought patterns and bless me with good mental health. May I not be held captive by feelings of anxiety or fear or anger or sadness. And may my brain function with order and control. I am blessed when I take refuge in you. I am so thankful that you sustain me and you are the lifter of my head. I can rest and enjoy your peace that passes understanding. Amen. So I hope you guys enjoyed that. I hope that was able to help somebody, and I hope the series continues to help somebody. So stay involved. Stay involved. There's always someone out willing to help you. There's always somebody ready to help you. Just be active. Reach out. Don't be embarrassed. Don't be ashamed. We love you. 31 days of Mental Health Awareness Month begins now, and you are in it, and we're ready to roll and have fun, and of course, heal our minds and get back our peace and stay level and keep it pushing. Thank you.